Good morning, class. We will begin Chapter 17, Hygiene, page 353. The learning objectives: define hygiene, name 5 hygiene practices that most people perform regularly, give 2 reasons why a partial bath is more appropriate than a daily bath for older adults, list at least 3 advantages of towel or bag baths, name 2 situations in which shaving with a safety razor is contraindicated, name 3 items recommended for oral hygiene, identify 2 methods to prevent the chief hazard when providing oral hygiene to an unconscious client, describe 2 techniques for preventing damage to dentures during cleaning, describe 2 methods for removing hair tangles, name 2 types of clients for whom nail care is provided with extreme caution, name 4 visual and hearing devices, list 2 alternatives for clients who cannot insert or care for their own contact lens, discuss 4 reasons for sound disturbances experienced by people who wear hearing aids, describe an infrared listening device. And as I go through the chapter, I have just abbreviated learning objective LO. So I will tell you whichever section, which learning objective, I'll just state LO number, whichever. So hygiene. Of course you must know all of this paragraph. Hygiene. Those practices, and this is Lecture A, and this is LO number 1. Hygiene, practices that promote health and promote personal cleanliness. There are different activities that we perform and we will perform for others that will promote their hygiene: bathing, performing oral care, cleaning, maintaining fingernails, toenails, hair care, shampooing, grooming hair. All of these are lumped into what we call activities of daily living, ADLs. ADLs. Hygiene also includes care and maintenance of devices that they may have: eyeglasses, hearing aids, contact lens. Hygiene practices and needs differ according to someone's age, their inherited characteristic of their skin and hair, their cultural values, and state of health. And I will state at the very beginning, if you think you're too good to perform ADLs, if that's not a nurse's job, you are in the wrong class. So we're going to begin with the integument. Mrs. Foster may have already covered this in A&P. Integumentary system. The integument, and you need to know, of course, is the covering. It's the collective structures that cover the surface of our body and its openings. Most hygiene practices are aimed at maintaining or restoring healthy integumentary system, and that includes the skin, mucous membranes, hair, and nails. All of this is included in the integumentary system. The skin on the next page, 354. I want you to know that the epidermis is the outermost layer of the skin. That's what we see. The epidermis, the outermost layer of the skin. This contains dead skin cells that form a tough protein called keratin. Keratin is a protectant. It protects the layers and structures within the lower portions of the skin. The dermis is the true skin. Dermis equals true skin. The subcutaneous, and I abbreviate that sub-Q, the subcutaneous, but you must abbreviate that now subcut if you abbreviate. So the sub-Q layer separates the skin from skeletal muscles. It contains fat cells, blood cells, nerves, roots of hair follicles, and glands. This is not necessarily a highlight for exam, But skin structures, remember, the skin is the body's first line of defense against infection, intact skin. And we want to prevent non-intact skin. Prevention is much higher on the scale, because if we can prevent an open wound, that will save the client a lot of trouble and pain, possibly infection. The types of skin glands, table 17.1 on the bottom of the same page. I want you to know sudoriferous. The sudoriferous gland secretes sweat. So sudoriferous equals sweat gland. Ceruminous equals cerumen, which we call earwax, cerumen. Sebaceous is sebum, oil, a protectant for our skin. You do not need ciliary for this exam. The general considerations on that page, you do need this. Benign skin lesions. Benign means they're not cancerous. Benign. They're just there. They're not causing any trouble. Such as seborrheic keratoses, tan to black raised areas, and senile lentigines. Lentigines, brown flat patches on the face, the hands, forearms are common in elderly people. You will hear these called age spots. They're senile lentigines. Mucous membranes, nothing really for the exam, but they line the passages of the digestive, respiratory, urinary, reproductive system. Hair, you know what hair is. The next page, table 17.2, page 355, examples of integumentary disorders. I want you to know the condition furuncle, which in lay terms is boil. A furuncle is a boil, a raised pustule, usually in the neck, axillary, or groin area that feels hard and painful. A client teaching that we should teach the clients, if they have a boil, use separate face cloths and towels from the rest of the family, launder their personal items separately in hot water and bleach. Psoriasis, you need to know, non-infectious skin disorder that appears as elevated silvery scales. Stop. Psoriasis equals silvery scales throughout this entire program and NCLEX. So silvery scales that shed over elbows, knees, trunk, and scalp. Acute episodes occur between periods of relief. So acute, remember, means suddenly. Psoriasis never completely goes away. They may take medication, it may look better, it may not itch as much or hurt, but then it will flare up. It will have an acute flare-up. We want to tell the client with psoriasis, follow medical regimen, and it's probably going to be lifelong. We need to tell clients too, this is important, be very careful of advertised quick heal remedies. Oh, they promise a cure, just send us your money. No. Pediculosis, lice infestation. Welcome to nursing. You will deal with clients with lice. So these are brown crawling insects that move over the scalp or the skin. They deposit yellowish white eggs, which we call nits, on the hair shafts, also on the pubic hair. The skin bite causes itching. We will talk about that more in depth in a future chapter. What you need to do, the client teaching, inspect the client's skin carefully as adult lice move quickly from light. The singular is a louse. I have seen a louse crawl through the head. Look for eggs, nits on hair, 1/8, I can't see what that's saying, I'm sorry. 1/4 to 1/2 inch from the scalp or skin surface. Do not share clothing, combs, brushes, anything like that, because the lice can be spread that way. Use a pediculicide chemical that kills lice, in addition to a lice comb and manual removing. Do not use hair conditioner, because hair conditioner coats the hair and it protects those nits. They're like, oh, we love this, we're just going to pop out and become lice. Do not do that. Scabies, you need to know. Infestation with an itch mite. It burrows within the webs and sides of the fingers, around the arms, the axilla, waist, breast, lower buttocks, and genitalia. So we want to tell the client with scabies, bathe thoroughly in the morning and at night. Apply the prescribed medication after bathing. Don clean clothes after bathing. Avoid skin-to-skin contact with uninfected people. Use separate bathing and grooming articles. Tinea capitis, pedis, corporus, and crurus. You need to know this. Fungal infection in the scalp. Tinea capitis is the scalp. Fungal infection in the feet, tinea pedis. In the body, tinea corporus. The groin, tinea crurus. That appears as a ring or cluster of papules or vesicles that cause itching, become scaly, cracked, and sore. So the client teaching on this, again, use separate bathing and grooming articles. Keep body areas dry, especially in the folds of skin. Wear clothing that promotes evaporation of perspiration. Also, I want you to know candidiasis, the last skin disorder. Candidiasis is a yeast infection. Just know right now that is a yeast infection. Let me go back to the tinea for just a minute. Tinea crurus, the lay term for that is jock itch. So you'll say, oh, okay, I've heard of that. Page 356, oh, this is showing, let me say, figure 17.2 at the top of 356, an example of keratoses, plural, figure A, and senile lentigines, liver spots or age spots. You need to know, and under that, on the left-hand column, sebaceous glands in hair follicles release sebum. Of course, we know that's oil. Oily secretion adds weight to the shafts of hair, causing them to flatten. We know if we have oily hair, our hair is flat against our scalp, and it attracts dust and debris. So depending on ethnicity and culture, we will perform. Hair care is usually performed washing someone's hair in the nursing home every other day. Someone of African American heritage, or maybe some Asian clients, hair care once a week. We will ask to make sure. Nails, there's really nothing on nails for exam, but I want you to know, let me throw back a memory for you. If your nails, they cannot be polished, period. If you hold your nails up and you can see them, cut them. They are too long. Now for the clients, you may clean the nails, file the nails. In clinical, you may clean the nails. You better clean the nails. You will walk in and residents will have dried brown in under their fingernails. That's where they have been digging at their buttocks, their anus, and got BM in under their nails, and no one cares enough to clean their nails. You will clean nails. That concludes Lecture A.